Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundoora, and I endorse this clip or product.
This clip is an overview of the osteology of the thigh. So we talk about the thigh, we need to know where it lies anatomically. So what are its relationships? So we can see that the thigh is inferior to the pelvis, so we say the pelvis is superior and more medial than the thigh. Posteriorly, we have the gluteal region. Inferiorly, we have the leg. So the thigh is proximal to the leg and distal to the pelvis. Looking at the osteology, the bone anteriorly and a posterior view over here, we have the head. The head of the femur, which is the bone in the thigh, fits into the acetabulum of the pelvis. So this is a ball and socket, with the head of the femur being the ball. We have a number of bony landmarks, these protuberances for attachment. The main ones we'll be looking at are the greater trochanter and the lesser trochanter proximally. Obviously, posteriorly there's a gluteal tuberosity, adductor tubercle. This is where our adductor muscles, which we find medially, where they attach to cause adduction of the hip. We have the condyles, both medial and lateral. Again, medial and lateral posteriorly. And sitting on these is our epicondyle. Our thigh has a number of muscular compartments. So intermuscular septa, dividing the thigh into muscle compartments. We have a medial intermuscular septa, inter meaning between, muscular being muscle, and a septum is like a wall. So it's just a separation between muscles. So medially we have a medial intermuscular septum, and laterally we have a lateral intermuscular septum. This separates our thigh into what we say is 3 muscle compartments, sometimes called fascial compartments. We have an anterior compartment. This is where we'll find our quadriceps muscles, for instance, muscles which generally, mostly, are going to extend the knee. Medially, we have our adductors. These are going to cause adduction of the hip. And posteriorly, although there's no fascia separating these compartments, posteriorly we're going to find our hamstrings. So muscles of common function are located together in a muscle compartment. So these anterior muscles, they have a common function. Most of them extend the knee, so they're located together. They're innervated by the same nerve, the femoral nerve, and they have the same arterial supply, so and venous drainage. So we get the femoral artery, for instance, supplying some of these. Medially, again, the same function. They adduct the hip, have the same innervation. The obturator nerve have the same blood supply, that obturator artery. Posteriorly, these are all knee flexors, and they generally have the same innervation, so our sciatic nerve, the tibial component, and the same blood supply, so that profunda femoris artery. So again, anterior, knee extension, femoral nerve, femoral artery, femoral vein. Medially, these are hip adductors. They have branches of the obturator nerve, anterior and posterior. We have an obturator artery and its vena comitantes, or accompanying veins. Posteriorly, we have many of these muscles causing hip extension and knee flexion, innervated by the sciatic nerve. tibial division, they'll also have a similar arterial supply, that profunda femoris artery and its vena comitatis. We have fascia in the thigh. Deep fascia covers all our muscle compartments, but in the thigh we have fascia lata, meaning thigh. The inguinal ligament is the superior attachment of this fascia. Joins to the pubic arch and the pubic tubercle around the iliac crest, attaches to the sacrum, the coccyx, and inferiorly will join to the bone around the knee and crural fascia. So this is a big, deep fascia of the thigh, and it's just wrapping that entire region. More laterally, we have the iliotibial band, which is of interest clinically. Lots of clinicians refer to the ITB. Many of you would have heard of that. So this is a thickening, and this occurs laterally, a thickening of that fascia. It extends from our iliac tubercle to the lateral condyle of the tibia. And this is an insertion for our tensor fascia lata and our glute max. Right, time for a quiz. So answer the following, put your answers on the forums. Summarize what the anterior group of muscles will cause at the knee. So that anterior compartment. The posterior compartment has muscles which will cause what at the knee? Answer those and discuss on the forums. Thank you very much.